So we're going to talk a little bit about your hip replacements that you had on both sides. And how long ago was the left side done?
3 years ago in July.
And the right one was done how long ago?
About March 3rd, 2020.
So that's 6 weeks maybe?
Something like that.
Not even. Probably like 4 weeks, right? Because this is only April 25th.
Yeah.
So a week, you're a month out, and let's see you take a few steps, and we're going to talk a little bit about. Well, you're not using a cane or a crutch, right?
No.
And
are
you taking a lot of pain pills and a lot of?
I got rid of those a long time ago.
Good. Have a seat there. So you're pretty happy with your hip replacements.
I am.
And one of them was done with a pocket incision in the back on the left 3 years ago, but you had the front incision called the anterior hip done on the right. And how do you think those two compared?
I think they were both good, but as far as my rehabilitation and getting healthier, better, and quicker, the front one was better. More fast recovery.
And you were how long in the hospital for that? Just overnight?
Overnight.
And you did some therapy at home, and you're pretty much done with therapy already?
I do my own therapy, just a lot of walking, and I still do my leg exercises.
Great.
That's a big key because it seems like almost every week I've branched into a new step of healing. You know, it's little things, reaching for something, putting a sock on, putting your shoe on. I just was able to put my shoe on the other day without this big long shoehorn that I have. So every little thing you do is a step towards progress.
Yeah, and you're only a month out from surgery. And I tell people there's almost 35 muscles that go across the hip joint from your back into the leg, and they all have to stretch out some after a surgery because they've been tight because the hip had arthritis.
Right.
So I guess I'll finish with a simple question. Do you want your old hip back?
No, I do not.
Well, thank you very much for doing this talk in our COVID environment.